When we talk about the neck problems, okay, we don't just talk about the neck pain. Sometimes when you have a neck problem, you have other symptoms. Pain. Do you have a numbness? Do you have a weakness? Do you have a tingling? Do you have a shooting sensation, shooting pain down your arms? I'll tell you what not to do when you have a neck pain. What you should not be doing is, let's say, going to a chiropractor, okay? Which unfortunately is a very common phenomenon, a very common belief that when you have a neck pain, you go see the chiropractor. I can tell you it's probably one of the worst things you can do. The reason why I say this, because in this episode, we're gonna talk about the neck pain. What is the neck pain? What are the causes of the neck pain? How to prevent the neck pain from happening? How to treat this to avoid surgery? I'm Dr. Yevgeniy Khavkin. I'm a neurosurgeon. I'm a fellowship-trained neurospine surgeon. And then we're gonna now talk in more details about this. We also have another episode previously where I talked about the back pain and the headaches. So if you'd like, you can certainly subscribe and see and get educated more on those problems. So let's talk about the neck pain. As you know, it's very common. A lot of people have a neck pain. Is it normal? Is it concerning? What happens? So sometimes people have neck pain once every couple of weeks, once every couple of months. Some people have neck pain every day. Obviously, a lot of factors that contribute to the neck pain. Some people have certain sleeping habits that lead to the neck pain. They wake up in the morning, and because of the way they slept, because of the pillow they used, because of the mattress they have, they wake up with a problem. Some people have more serious problem, when it's not just the chronic neck pain, which sometimes can be debilitating, but also pain that radiates down to the arms. What does radiation mean? Radiation, which we call radiculopathy, is what the pain from the neck shoots down to the shoulder and shoots down to the arm. Now, it's very important to differentiate where this shooting comes from, because a lot of times I see people who have a neck problem, but they also, on top of this, have a shoulder problem or elbow problem. So knowing exactly where the pain is coming from and what the source of the pain is probably by far the most important thing in deciding how to treat the neck pain. Salim, how are you?
I'm good.
It's good to see you.
Good to see you.
Thanks so much. So my friend Salim agreed to be a patient for us today, so I can show you how to do the examination. When we talked about the examination for the problems of the neck, of the lower back, problems with the headache, what exactly do I do when the patient comes to see me? And I told you a big part of this is that I'm having discussion with the patient, asking what kind of problems, what the distribution, and then the second part is that I do the examination to assess if there's any evidence of any nerve damage, any numbness, any tingling, any evidence of the spinal cord compression. So the only way to assess that is by examining the patient and doing a very thorough physical examination to assess if there's any changes in the neurological function. Okay? So the first thing I'm going to ask, Salim, how you doing?
I'm good. Great.
Okay. So I understand you have some neck pain.
Yes.
All right. Can you show me exactly where the pain is?
Here?
Right there in the back of your neck?
Yeah.
Okay. Is it standard where I press on this?
Yeah.
Okay. A little bit more to the right side, correct?
Mm-hmm.
Okay. Does the pain go anywhere down to your arms at all?
No.
No. So pretty much just stays in this area. Okay. Any pain, let's say if I examine your shoulder, if I touch your shoulder, any pain here?
No.
No? Okay. All right. Any pain here? So this is very important to assess that, because sometimes patients have a pain that's going down the arm, and in fact it's not coming from the neck. In fact, it's actually coming from the shoulder. So it's a very common, actually, misdiagnosis when the patients with the shoulder problems get treated for the neck and vice versa. So whenever you see a patient with a neck pain, especially if there's any radiation down to the arm, it's very important to assess if there's any problem with the shoulder. The same thing, I assess the arm. So any pain here when I touch the elbow here? No pain here, no tenderness. Okay, the same thing here. Any tenderness, no pain there? Okay, good. All right, now go ahead and give me a good squeeze here. Squeeze hard, as far as you can. Good, wonderful. Okay, go like this. Okay, push me away. Push, push, push. Good. Pull back. Pull, pull, pull. Good. The same thing here. Push. Good. Pull back. Good. Hold your arms up this way. Keep it up. Keep it up with it. Yeah, keep it up. Don't let push it down. Good. Perfect. Okay. So I assess the strength. The strength is good. He's a strong man. I already knew that. So my recommendation always, whenever you have a neck pain that is serious enough that it's affecting your lifestyle, affecting your quality of life, affecting you on a daily basis, do the proper evaluation. I'll tell you what not to do when you have a neck pain. What you should not be doing is, let's say, going to a chiropractor, okay? Which unfortunately is a very common phenomenon, a very common belief that when you have a neck pain, you go see the chiropractor. I can tell you it's probably one of the worst things you can do. The reason why I say this, because in my decades of practicing medicine, unfortunately I've seen a number of patients who actually got injured with a neck pain as a result of the chiropractic treatment. Everything from the nerve damage to sometimes paralysis. Sometimes there's a damage to the blood vessels that go through the neck, and the manipulations by the chiropractor can lead to what's called dissection of those blood vessels and can lead to a stroke. So the first thing you need to do when you have a neck pain, find out what the problem is. When you come to see me, when you come to see a specialist, my recommendation always get the imaging studies first. Most commonly MRI, sometimes I also order CT scan. One of my other episodes talks about the differences between the CT, the MRI, why we order which studies, and also helps you better understand the findings in the imaging studies. So we're gonna go step by step for you to have a better understanding of what those findings mean on the MRI and the CT scan. So you subscribe to my channel and you'll learn more about this. So now what we're gonna do is we're gonna check the sensation, all right? So I'm gonna ask Salim, do you feel when we touch it here? Does it feel the same on both sides? Feels about the same?
Yes.
No numbness, no tingling, no changes in the sensation, right? Okay, so now I'm gonna check reflexes. So I'm gonna ask him to relax his hand, and I'm gonna check to see if there's any abnormal reflexes. What it means is that sometimes when you have a pressure on the spinal cord, it creates what's called hyperreflexia, where reflexes become very brisk. So as soon as you check the reflexes, you can see the spasticity. Fortunately, he doesn't have any of this, but it's very important to check that. Okay, so we're checking reflexes in the arms, checking reflexes here. Okay, and so that's the basic examination that we do on every single patient who comes to see us with a problem with the neck, and to see if there's any other parts that are involved that may be mimicking the neck problems, but in fact it could be something else. So going back to the neck pain, one is that I want to see the intensity. I want to determine what the intensity of the neck pain on the scale 1 to 10. Two, I want to see if it's also associated with some signs of what we'll call a nerve damage. Do you have a numbness? Do you have a tingling? Do you have a weakness? Sometimes people say that because of this problem, I'm having difficulty using my arm, I'm having difficulty lifting my arm, or I have a numbness or tingling or weakness in certain parts of the arm. If you have a more advanced stage, sometimes people have muscle atrophy. When they look on one side and the other side, they can see the difference in the bulk of the muscle. Those are all very concerning findings. That's why the important thing is to get the MRI, know exactly what the problem is, and then once we examine this, once we examine you, see exactly what the findings are on the exam, see what the imaging studies show, then the next step is for me to recommend what to do. The goal always is try to avoid more invasive procedures. You know, as a spine surgeon, I've done over 8,000 spine surgeries, but my goal is always try to avoid surgery. I always say, and I've mentioned this in the other episodes, the best spine surgery is the one you can avoid. So my goal of this channel and talking to you about this is to teach you and educate you what to do, how to minimize the chances that you're ever going to require any surgical treatment. So let me tell you about a few cases that I've encountered that, for example, as you know, I'm here in Dubai right now. I have a practice here in Dubai, I have a practice in Las Vegas. One of the first surgeries I did in Dubai, when they invited me for me to fly here to do the surgery, was an older gentleman who was in his early 80s, and he fell and he had a damage to the neck. And what happened is that it pinched off the spinal cord, and because of that, he started developing what we call a quadriparesis, which is a progressive weakness in his body. His arms, his legs. He had different specialists come to see him from Switzerland, from Germany, from other places. And because of the complexity of the problem and because of his overall condition, his heart condition, his lung condition, nobody would actually want to touch him as a patient. But what was happening is that he was getting progressively worse and worse. And when they actually finally reached out to me, they found me through the contacts in the States, and I came in here to evaluate him. He's essentially been laying in bed for several months. He can barely move his arms, he can barely move his legs, and the whole picture was looking very, very sad. And I had a long conversation with the patient, with his family, the local Emirati family, very intelligent, you know, very understanding. And I told him, listen, if we don't do anything, the outcome is clear. Probably a few more months and he's going to develop pneumonia, blood clots, and he's going to be gone. If we do the surgery, and if it's the right surgery, and if it's done very technically efficiently to minimize the time under anesthesia, there's definitely a chance that he may recover some of the function. He may also not recover any function, or he can actually not even make it through the surgery. So you always have to be very honest, very transparent, very realistic in discussing the expectations with the patient, and especially discussing the potential risks and benefits. So after talking to this gentleman, he decided that he wants to have a surgery. He clearly understood that the alternative is really, very, very bad. And the long story short, we did the surgery here in Dubai. Surgery went great. It only took a little bit over an hour and 15 minutes to do the surgery. I did the surgery, and I'll show you in one of the other episodes, actually more details about this patient with the images of his spine and exactly the kind of surgery I performed. Essentially, the surgery was a posterior cervical decompression and fusion. So they did a 5-level posterior cervical decompression, took the pressure off the spinal cord, and then I put the hardware instrumentation to stabilize the spine to prevent the spine from falling over. The surgery went well. Fortunately, his heart, his lungs tolerated procedure well. The key component was, one, is that we had an amazing anesthesiologist. We did this here in Mediclinic, Parkview, and the anesthesiologist was amazing, and it's extremely important to have the right anesthesiologist, especially for older person like that. Because the big part of the surgical risk is not just the surgery, but it's also risk of anesthesia. So back to this patient, he recovered nice after the surgery. It took probably 2-3 months for him to actually start regaining function. The last time I saw him was about 3 months ago, which is about 2 years after the surgery. He's now dancing, he's traveling all over the world. When I come to his house, he meets me at his door and gives me a hug. So it's obviously a very gratifying outcome of the surgery. But the key is that if you do the right surgery for the right patient, with a clear understanding and clear discussion of the risks and benefits that potentially involved with the surgery, the outcomes could be absolutely amazing. Now, when we talk about the neck problems, okay, we don't just talk about the neck pain. When you have a neck pain, it's kind of obvious that you have a problem with the neck, you need to do something about this. Sometimes when you have a neck problem, you have other symptoms. For example, you may have balance problems. Why? Because there's a structure in the neck called spinal cord, and the spinal cord gets compressed, it potentially can cause what's called ataxia, when the rest of the body coordination is being affected. So if you have problems with walking, if you have balance problems, if you're tripping over things, if somebody notices that your gait has changed, that may be coming from the neck, number one. Number two, if you have a pain in the shoulder, in the arm, anywhere in the leg, shooting down the leg, anywhere in the arm. Again, you may not necessarily have a neck or back pain, but the problem may be coming from the spine. So it's very important to be conscious about this and understand that the spine problems, the neck and the back problems, can manifest themselves very differently than just the pain in this area. So because of the fact that you have a spinal cord in your spine and you have nerve roots, the manifestations of the pressure on the nerve roots on the spinal cord can go way beyond just the pain in the neck and the lower back. So always be very conscious about this and realize that sometimes, maybe because the other problems have not been diagnosed or treated either properly, you don't have good outcomes, maybe something is missed. Maybe they're missing the fact that this problem actually is coming from the spine as opposed to joints, as opposed to brain, as opposed to some other problems that doctors may be treating, but they're missing the spine origin of this problem. So in summary, if you have any problems with your neck, if you have any pain in your neck, if you have any pain in your arms, if you have any pain in the legs, if you have problems with walking, if you have problems with balance, problems with coordination, please be aware that it may be coming from the spine, from the neck, and you need to have a proper diagnosis and proper treatment done. If you have any questions, please put this in the comments. I'll be happy to answer the questions. And please just subscribe to my channel so you'll learn more about your health, about your spine health, about how to recognize problems and how to better decide what to do, what not to do about the problems with your spine.